According to the Data Resource Center for Child and Adolescent Health, Massachusetts ranks 22nd overall in the nation for overweight or obese children, with 30% of kids considered either overweight or obese. And it's a problem that's on the rise. Carolee McGrath sat down with Dr. Beth Brown, a pediatrician with Holyoke Medical Center, to find out more.
Childhood obesity is quite prevalent, and unfortunately it's on the rise. At this point, approximately 1 in 5 children is in the category of obese. And that's actually more so in certain ethnicities. But overall, for the United States, it's 1 in 5.
So when you say in the category of obese, how is that determined?
So that would be greater than the 95th percentile in terms of height for weight on the growth charts.
Okay, and as we were just talking about, that could be kids who, might shoot up after gaining some weight, around 10 or 11 years old, or it could be somebody, who could be headed down that path. How do you determine that? And how do you talk with families that, hey, you're at the 96th percentile and, we need to make some changes?
So one of the things I pay a lot of attention to when I'm looking at growth charts is the trajectory that kids are following. So one of the things that growth charts are very helpful for is to look at over time, how is a child's weight and height changing? Because they should really be on their own curve, and they should stay on that curve. And we know approximately how much they should gain and grow over a year. If I start to see that trajectory changing dramatically, either they're gaining too quickly or not gaining enough, that's a red flag for me. And once I'm seeing a child whose weight, BMI is above the curve, so above the 99th percentile, that's alarming for me. Mm-hmm. But if I start to see that trajectory accelerating, that's a point to start to intervene with that family.
And tell me about the health risks that come with this.
So there are a lot. We see, unfortunately, the risks are for type 2 diabetes. It's becoming much more prevalent among children. There's risks for cardiac disease, hypertension, and those are probably the main ones.
And why are we seeing this, would you say?
I think it's multifactorial. There's no question that the American diet has become a lot less healthy than it used to be. And there's a lot of convenience foods that are marketed for busy families on the go. Sugary drinks are a big thing. We used to counsel families a lot around juice, and I think a lot of families have started to recognize that, soda's not healthy, and there's even a little more recognition now that juice is also a lot of empty calories.
Right.
Now what I see a lot of are the sports drinks. So a lot of Gatorade becomes the thing that is replacing that. And all of those things really, soda, fruit juice, Gatorade, sports drinks, they all are, packing between 200, 300 calories per serving. And they're not really giving any nutritional benefit.
And what about kids' activity level as well?
Yeah, so sedentary lifestyle, we certainly are seeing children's activity levels decreasing. Screens are a huge factor with that. So toddlers, preschoolers, they're spending a lot of time with screens. And even school-age kids who used to be, they'd come home from school, they'd go out and play, run around. Sometimes it's that the neighborhood's not safe to play in, but even in safe neighborhoods, a lot of times they're drawn in by their screens.
When you're sitting down with a mom in the office and you're showing her the chart, not a comfortable conversation to have. Right. So how do you turn this around? So
one of the ideal things is to be doing prevention, right? And so when we first start to see that trajectory change in a perfect world, at that point, stepping in, it's a lot easier to intervene with a younger child because the parent is still in charge. The parent is still buying all the food. The parent is still providing the meals. And it's harder with adolescents for lots of reasons. So when I see a child starting to accelerate with their weight gain beyond what's appropriate, I'll have a conversation, and it is a tough conversation to have. Food is love, right? And I think that's something that I've become more aware of with my own children and with my families is it's really hard to separate those two things out. And sometimes we have kids who are in the care of grandparents, and the grandparents want to feed them as a way to be loving them. So sometimes having conversations around go buy a special fruit treat rather than those cookies or donuts.
Let me ask you a little bit about the teenagers, though. That can become a very difficult conversation, and you have to walk a fine line, certainly as a pediatrician, that yes, you want them to be healthy, but you also don't want them to develop a complex about how they look. Like, how do you have that conversation so it doesn't become, oh gosh, now I have to look at the scale and I have to worry about, you know, what I'm wearing? How does that play out?
So one of the things that I try very hard to do with teens is focus on health and why it's healthy, why I'm concerned about their diet and their level of activity purely based on their health, and not so much on the numbers and the charts and what they look like. And so I will stress for them that, you know, being active every day is not just good for their physical health, but also for their mental health, right, for their well-being. And, you know, the importance of not eating empty calories. So that becomes a big thing for me to focus on is, you know, everything you put in your body should be something that's helping your body grow or develop.